Okay, my name's Roger Smith. I'm Professor of Equine Orthopaedics at the Equine Referral Hospital of the Royal Veterinary College. I'm going to give you a short presentation on some of the work we've done in trying to advance treatments for tendon injuries in horses. And this is very much work that has gone on over the years at the RVC. So a little bit of background beforehand is what I'm most interested in is understanding the cause and also achieving better results with treatment for tendon overstrain injuries in horses. But of course, this is an injury that's common also in humans. This is a video from Sky showing the moment the Achilles tendon of David Beckham's left ankle was ruptured. And this injury actually has a lot of similarities with the injury we get in racehorses, which is shown on the right-hand side here. Where we have swelling in the metacarpal or cannon bone region of the horse, developing as a consequence of athletic exercise, just like in humans. And it results in disruption of the central part of the tendon, as you can see here, which we also pick up on ultrasound as well. And we know that in national hunt racehorses in particular, that we have an incidence of around 25% in horses that are in training. But actually, almost 50% of limb injuries on racehorses involve injuries to the supporting structures on the back of the metacarpal region. And not only is this an important problem for horses, but things that we can learn in terms of causes and treatments for horses actually represent a good example of the One Health concept, that the horse is actually a good model for the human tendon disease, with this similarity between this injury to the superficial digital flexor tendon in the horse with a similarity to the Achilles tendon in humans. So why did tendons fail in the first place? Well, in the horse in particular, and the Achilles tendon in the human is similar, the horse acts very much like a spring, a bit like this child toy here, being able to allow the horse to sort of bounce up and down on its front legs for energy efficient locomotion. But at the spring aspect of this tendon, I'm trying to illustrate in these two videos. So on the first video here, we have my son when he was young bouncing up and down on a child's pogo stick. But when I try and do the same sort of thing, as you can see here, that stiffness of that spring is not optimized for my weight because I'm a little bit heavier. So the concept in the horse is that the tendons on the back of the leg are optimized in terms of their stiffness to make them efficient for storing energy and for this sort of energy saving capacity. But at the same time, the tendons operating very close to their functional limit. The superficial flexor tendon is subjected to around 1 ton peak load on a structure that's only 1 square centimeter in cross-sectional area, which is quite a challenge on the engineering front. In addition, this tendon, in order to store this energy, stretches by a large amount. And in fact, it's been measured to stretch by 16% when the animal is galloping. And that actually is right in the middle of the range where we see these tendons rupturing if we take them out and pull them apart in the materials testing apparatus. In other words, there's very low tolerance in the system. So as a result, it's not surprising that overload will result in tearing of the tissue relatively easily. But added to that, we know that tendons do adapt during growth, but once you reach skeletal maturity, the equine tendon seems to lose this ability to adapt or even repair the micro damage. And in fact, the collagen half-life in an adult superficial digital flexor tendon in the horse is around 198 years. So you can see there's not a lot of change to that general structure of the tendon as the animal ages. And so we think that the majority of these injuries, which appear very much as spontaneous events during exercise, are not only a consequence of overload, but also because the tendon has been weakened through preceding tendon degeneration, which makes the tendon more prone to this injury. So what is the consequence of the injury once that has occurred? Well, the problem is as with all soft tissues, be it skin or tendon or ligament, that the tendon will heal, but it does so by the production of fibrous tissue. So it doesn't regenerate back to normal tissue. And this is illustrated in this graph here on the right-hand side, where these are just two tendons taken out of a horse post-mortem where it had suffered a severe injury, which had healed to one of its superficial flexor tendons. All we've done here is cyclically loaded those tendons, not to destroy them, so they reach a steady state, which is on the right-hand side of these loops, as it were. And so we have the load on the y-axis and the displacement, or the stretch, as it were, on the x-axis. And when it reaches a steady state here, the gradient of this graph, the gradient of this line, gives you an indication of the stiffness of the tissue. So the steeper the line, the more stiff the tissue is. And you can see that when we compare the relatively normal, uninjured tendon from the one on the injured leg, you can see that the gradient of this line is steeper for the injured tendon. In other words, that fibrous tissue has resulted in an increased stiffness. And that increased stiffness makes the tendon prone to re-injury. And so we see a very high frequency of re-injuries in these horses, up to around 60 to 70% in racehorses will re-injure again once they return to their athletic exercise. Now, to try and illustrate how that occurs, here's a little model I created several years ago now. So we've got two bits of elastic here. This is to signify a normal tendon. As you can see, as we move the two bits of wood apart, we can see the dots are 1 centimeter apart. You can see that the elastic stretches nice and evenly along its length. So this is like a normal tendon, an approximation. On the right-hand side is a piece of perished elastic. So you can see that the dots do not move apart in the middle here because it's lost its elasticity. But as a result, in the animal exercising maximally will result in overstrain of the adjacent sites of either side of the perished area. And you can see those dots sort of move apart to a larger extent because of that. And this puts extra strain on that area and results in a high frequency of re-injury. In addition, of course, when you lose that elasticity, you also potentially have an influence on its performance as well. Now, in addition, some injuries will usually do, in the early stages at least, cause pain, so that can be an additional consequence of the injury. But actually, in many situations for the superficial flexor tendon, that period of pain is short-lived. And as a result, most of our treatments really are aimed, or should be aimed, at optimizing that function to avoid the risks of re-injury as a result. Now, just before we talk about some of the treatments that we try to develop to address that and to improve function, just wanted to sort of illustrate that there's quite a large number of developments in this field over the years, and probably a lot of it reflects about our really improved imaging capabilities now. We have not only an ability to look at blood flow in tendons with this Doppler imaging similar to what's used in hearts, of course, which is a common what happens commonly post-injury is you get a massive increase in that blood flow. So we can detect that with our ultrasound. But of course, with the advent of MRI, we can identify injuries in the foot, for instance, here, of deep flexor tendon, where it was difficult to do that in the past. So we now can see and identify these injuries much more readily than we did in the past. In terms of better treatment, I suppose some of those injuries that occur within a tendon sheath, we can evaluate, identify tenoscopically by putting minimally invasively by putting a little camera inside the tendon sheath and seeing these sort of tears, as you can see in this video. And we can, when we can resect these tissues. This is a manica flexoria tear shown in the video here, but also this is post-resection, where we have a good prognosis when we've removed those damaged tissues. But sometimes we can't do that, and the tendon is in itself is damaged, and if we remove that, that would obviously compromise the function of the limb. So we're interested in trying to develop treatments that will improve the healing in those situations. And as a result, we have sort of become interested in the use of biological treatments to try and induce a regenerative response, so-called regenerative medicine. And this is because many of the current medical treatment strategies have only a small effect on prognosis. In other words, they're relatively ineffective. So what we want to try and do is improve better function and better quality of repair. And this is sort of brought in the interest of regenerative medicine, where we apply a biological therapy to try and improve the repair process that goes on in the tendon. And this really started with our investigations on the use of stem cells. And in fact, the adult stem cells, the ones we recover from the individual patient, so these are autologous treatments where the cells are put back into the same animal after a period out in the laboratory, derived from the bone marrow as being the one that we've investigated the most, as part of the body's natural healing system. Now, in addition, the injury has a receptacle, this damaged area inside the tendon, where it's quite easy to introduce a needle into that area and administer the cells directly. So we can deliver them directly to that area of interest. And the stem cells, of course, have that potential of differentiating into different tissues. And this is shown on the right-hand side as well. In the laboratory, we can show that they'll become bone cells, fat cells, and cartilage cells. And so this always became an attractive way of trying to regenerate the tendon tissue post-injury. And we published back in 2003 the first report of injecting stem cells into an injured superficial flexor tendon as an attempt to harness those regenerative capacities of the cells. And the technique that we used is shown here. It was developed in conjunction with a spin-out company from the RVC, which is to take bone marrow from the sternum of the horse. And because there's very few stem cells in that bone marrow, we need to culture them in the laboratory, and that takes around 3 weeks to do. We then suspend them in the supernatant of the bone marrow that they originally came in. That's so that we don't inject anything foreign into the horse, and because the supernatant has a very nice, rich mix of growth factors in them. And using ultrasound-guided injection, so we can make sure we put it in exactly the right place, we can inject them into that tendon, the same horse, in other words, an autologous treatment. And the horse then enters a rehab program that's no different from the normal rehab program that we would use even if we didn't use the stem cells. And of course, the question is, well, that's great and it sounds very exciting, but does it actually work? Number of experimental studies in a whole different array of laboratory animals right the way through to horses has seemed to look effective with beneficial changes to the tissue after treatment. And so what we tried to do is to see whether that was reciprocated in what we see clinically. And in order to do that, because randomized clinical trials are difficult to do in the veterinary industry, especially with racehorses, what we've tried to do is compare the outcome of our stem cell treated horses with studies where the horses were selected and followed up in exactly the same fashion here. 2 studies from Sue Dyson in 2004 and O'Meara et al. In 2010, which was a higher number of horses to allow better statistical comparison. And this involved a 3-year follow-up and looking predominantly at re-injury rate, which we think is a very objective assessment of that function of the tissue. And this is just the data that we generated from an 8-year study, accumulating enough horses to be statistically powerful enough to be able to demonstrate an improvement. And you can see that the blue bars refer to the stem cell treated horses, and the red bars are from this study from Sue Dyson in 2004, relatively small numbers of racehorses. So this is the racehorse data here. And you can see that there was around a 50% reduction in the re-injury rate, which was statistically significant for the national hunt racehorses where the largest numbers existed, less convincing response in the flat racehorses. Now, when the second study came out in 2010, Brian and Miriam Bruce Bladen put together a nice large series where we had, before we did these studies independently, we had decided on the correct inclusion exclusion criteria and follow-up. And you can see his group had 192 horses where they included the analysis of the contralateral untreated limb. So there's no point in having a treatment that's effective on one leg that you treat and then for it to injure its other leg, which has been a problem of other treatments in the past. And we did the same here, and we can see that the re-injury rate goes up a little, but it's still around a 50% reduction, and this time, because of the larger numbers, a very highly significant reduction in that re-injury rate. We've also backed that up with sports horse data where we can see a similar reduction, although this wasn't independently validated. This came from the company, and therefore you've got to be a little cautious with the data, but it shows a similar sort of reduction in re-injury rate, which is very encouraging. Question is, how do they work? How, they may work clinically, but how do they do that? I always liken it to a sort of an orchestra. You have the musicians that make the music, and you have the conductors that provide the cues to make that music properly. And the stem cells could work in either of those roles. They could either be the musician, where they generate new tissue, which would be a truly regenerative response. There's actually very little evidence for that, and most of our data really don't support that as a role for these stem cells. In contrast, there's quite a lot of evidence that support the conductor role for these stem cells by their ability to modulate the immune response that is driving the fibrotic reaction. So you get a reduced amount of scar tissue with an optimized organization repair. And there's a lot of evidence to support that as the main role for these cells. So not truly regenerative, but nevertheless having a benefit in the repair process. Of course, that's a very brief overview of a lot of work over the last sort of 17, 18 years. What is it in the future? Well, we still have a number of challenges for this technology. I always sort of refer to the 3 R's, which are the ability to retain the cells, the regulatory hurdles that are being imposed as a result of using live cells, especially if you're using them across individuals, and then retail. In other words, the expense of doing this treatment. It's not cheap, and that does give us a challenge in terms of wheeling it out to all different cases that may require it. However, there has been an allogenic cell line, in other words, one that's developed in a different horse for treatment in an injured horse, that's received a European license for marketing of this cellular product, the first one, for osteoarthritis, and not for tendon and ligament injuries, but for the treatment of joint disease. And now that's marketed now as Articell Forte from Boehringer. So these products are now starting to become more widely available and more affordable. Of course, as I mentioned right at the beginning, one of our key interests is the One Health aspect to this, and that what we learn in horses could be used for the benefit of humans. And that's been publicized quite a lot in the press. And we have a stem cell trial that I've been involved in based in Stanmore, where we've been evaluating the same treatment protocols in human Achilles tendinopathy as I've described for the horse. But I think we have to be cautious about what this technology can offer. This is an article from the Daily Telegraph a number of years ago, showing that caution or expressing caution in terms of how we should accept how much stem cells can offer in the medical field. So I think we have to manage the expectations for this treatment. It's very exciting, but there will be limits on what we can do with them. Okay, so thank you very much. This is just one of the more famous horses that we treated with stem cells, Dream Alliance, that was subject of a film owned by a number of people in Wales that won the Welsh Grand National in 2010 and had been treated previously with stem cells for a tendon injury. Thank you.